Professor Viner, you've been as I mentioned at the start, you've been incredibly active in this, and I have nothing but admiration for what the Royal Society of Paediatricians has done and has been saying over many months. Could you just set out how you think should there be much more assessment of mental health and the other impacts on young people, school closures, and if you could just set out the situation as you see it.
Thank you. So, starting with, so children and young people under 20 they're about 15 million in our population. They make up about 23.5% of our population. And when we close schools, we close their lives, not to benefit them, but to benefit the rest of society. And in fact, children and young people, when we close schools, they reap harm from that. So there's been a lot of activity to try and quantify those harms, to be clear about what they all are. Much of the data we have comes from the first pandemic wave. And perhaps understandably, during that first pandemic wave, back in March through to May, it was very difficult to get data because most of our systems for gathering data were closed down. There has been some data collected as well over the summer and later. I'm aware of about 75 reasonable quality international publications on the harms to children and young people from the first wave of the pandemic. And we have around 25 academic publications from the UK, but there's, again, 50 from elsewhere. And they tell a very consistent story. The story is one of considerable mental health harms. And I think some of the reports we're seeing from the UK and elsewhere are suggesting up to 30 to 40% of children having really significant problems, when, of course, as a background level, it's much, much lower than that, at the sort of 5 to 10% level. There's also quite a lot of evidence around child protection. So there's evidence, 2 good studies from the UK and a study from the US, suggesting that child protection referrals for child abuse, if you like, fell by around 30 to 40% during the first pandemic wave. And the assumption is much of that is due to school closures, because we believe that schools are responsible for around 40% of child protection referrals. So and we also had a lot of evidence of reduced access to healthcare. Our presentations to emergency departments and admissions to our children's wards and to our child and adolescent mental health units and presentations for mental health problems were right down. So we had both an increase in problems and a reduced access to care. The protective safety net we put around our children was removed.
Before I start, I should make a declaration of interest that I work as a consultant paediatrician and I'm continuing to practice. Professor Viner, you talked about the increase in mental health, but you also suggested that mental health admissions to hospitals was falling when last measured. Do you have any more recent figures? I know on a recent shift that I did at the hospital, there were more acutely unwell children admitted for mental health reasons or mental health presentations than there were acutely medically unwell children on the ward. Is that an unusual pattern, or is that a pattern that you're seeing in other parts of the country too?
Thank you. Yes, that is absolutely a pattern that our paediatricians around the country have told us about since the beginning of this pandemic. And we've seen across all of our children's wards a bit of a shift towards more mental health problems being the reason that children come into children's wards. Our paediatricians and child and adolescent psychiatrists are saying that there is more pressure on eating disorder services, pressure on paediatricians who see children.
Specifically, what can government or should government be doing to try and reduce this burden of mental health problems?
Thank you. So I think the easy answer, the first answer, is to get children back into school as quickly as possible. The most important thing, and to say to the whole committee, the most important thing we can do for our children and young people's mental health is to get schools open again and get face-to-face learning and peer interaction happening. That is the most important thing we can do.